Good morning. Sorry, good afternoon. How is everyone doing? Okay. How are you doing? Happy Sunday. Is a good day. Just a minute. Hi. So today we are talking about. So today we'll be talking about diabetics. Yes. Hi. Is anybody there to join me? Welcome. Welcome to my live chat. Sorry, I'm trying to check. Trying to say hi, welcome. Hi, Shy Voice. Welcome, ma. Hi, family. How's everyone doing? Welcome to my life. So today, like I said, I'll be talking about diabetics. So let me hold on small, let other people come so that I can start. I don't want to be going back and forth. Welcome everyone. I'm trying to post. I don't know. I'm having an issue with my network. Hi. Welcome. Let me give some minutes to wait for others. Let's see, maybe some people will join us. So I want to be talking about diabetics, like I said. 50 and beyond. Welcome. Thanks for joining me. Welcome. My network is not connecting. Let me try. Okay, thank you. So let me share it to the group. Let me just send the link to the group. Thank you for joining me. Welcome. How is everyone doing? Hi, Shy Voice. How are you? How is family? 50 and beyond. Welcome. Income push up. Welcome. How is everyone doing? I hope you guys are hearing me. Please indicate if you can hear me, or maybe that is something I need to do. I just want to be sure that everything is okay. Well done. Okay, thank you so much. Thank you. 50 and beyond. Okay, so like I said, today I would like to be talking about diabetics. Okay, thank you so much. Thanks for that. Thanks for joining me. So I'll be talking about diabetics, like I said. So to start with, diabetes, also known as diabetes mellitus, is a group of disease that result to too much sugar level in the blood, so high blood glucose. And we have different type of diabetes. We have type 2 diabetes, type 1 diabetes, pre-diabetes, and gestational diabetes. So gestational diabetes is a form of blood sugar affecting pregnant women. While type 1 and type 2 is a chronic condition that affects the way of the body processes blood sugar, the way the body processes blood sugar. So that is the one for type 2. While type 1 is a chronic condition in which the pancreas produces little or no insulin. Where pre-diabetes is a condition in which blood sugar is high, but not high enough to be type 2 diabetes. So let me start with type 2 diabetes. So like I said, Type 2 diabetes is a condition that affects the way body produces blood sugar, which is glucose. So let's know that this type 2 diabetes is treatable by a medical professional. It requires medical diagnosis, lab test or imaging, and always required too. Chronic one can last for years and it can also be lifelong. So the symptoms, I'll still explain further more about the symptoms. The symptoms include increased thirst when you are always thirsty, frequent urination, hunger when you are always hungry, fatigue, blood vision, and other things, which I'll be explaining more further. So let's continue. The treatments. The treatments include diet, exercise, medication, and insulin therapy. So these treatments include physical exercise, like if you're the type that smokes before, by quitting smoking. Weight loss, if you are the one that is obesity, you try and reduce your weight. Dietary fiber, your nutrition, you get your nutrition by nutrition counseling and diabetic diet. The nutrition counseling, you meet your nutrition to get counseling from them to know what and what to be eating so that it won't affect your health. And also medication, there are anti-diabetic medication, statin and insulin that can also help you too. So physical exercise, like I said, physical exercise, aerobic activities for 20 to 30 minutes 5 days in a week improves your cardiovascular health. If injured, pursuing an activities to avoid injured muscle. You can also join group that exercise. Yeah, you register for this to exercise. You tell them your condition, they will know the type of exercise they will give you the exercise for you to be doing. Like I said earlier too, quit smoking. If you are the type that smokes, you quit smoking. And dietary fiber too. That is part of food that body can't digest. It helps control the sugar level. And nutrition counseling is also important. Your nutritionalist, you get counseling from them. You tell them what you are going through. They will know what and what to give you. They will know what type of food that is good and okay for you to take. So we also have anti-diabetic medication, like I said, that control the amount of sugar, the glucose in the blood. Statin too, it decreases liver production and harmful cholesterol. I hope you guys are still hearing me. Sorry, I'm at work and different noises. Sorry about that. So insulin, it can also treat diabetes too. So the medication, drug used in diabetics to treat diabetes mellitus by increasing glucose level in the blood, with the exception of insulin, most GLP-1 receptor agonists, and all diabetics medication administered, they have to do some certain tests to know the one that fits that they will give you. Some of the medication include besagliflozin and metformin and other ones, but don't do self-medication, please. See your doctor, your GP, general physician, to know the one that is okay for you. So like statin that I mentioned, stating a class of medication that reduces illness and mortality in people who are high risk of cardiovascular disease. Low density lipoprotein carrier and cholesterol play a key role in the development of atherosclerosis and coronary heart disease. So we are continuing. So insulin, like I said, insulin is part of the drug used to treat diabetes. So insulin is a peptide. Thank you, Amici. Thank you and welcome. So insulin is a peptide hormone produced by beta cell of the pancreatic islets, encoded by human by insulin gene. It is the main anabolic hormone of the body. So we do use insulin to treat diabetes. So most of the time, doctor normally starts with basal insulin, but I'm not saying you should do self-medicated. Please don't. Always meet your doctor, your physician. Let them prescribe what is good for you. Don't say, okay, my neighbor is doing this, my neighbor is taking insulin, let me go and buy it. No, don't do self-medicated medication. Thank you. So exercise, like I said, exercise is a physical activity that enhances or maintains fitness and overall health. It is performed for various reasons, including weight loss and maintenance, to aid growth and improve strength. It develops muscle and the cardiovascular system. It prevents injury and it improves our health. So I'm talking about exercise. It's good to exercise, like I said earlier. It's good to exercise at least daily, maybe 5 days in a week. 15 to 30 minutes exercise 5 days in a week is good for our health and for also our mental health also. So I also mentioned that part of the treatment is to quit smoking. If you are the type that smoke, it's better to quit smoking. So like I said, smoke cessation, usually called quitting smoking or stop smoking, is a process of discontinuing tobacco smoking. Tobacco smoke contains nicotine, which is addictive and can cause dependence. As a result of nicotine withdrawal, often makes process of quitting difficult. So like I said, it can be difficult for you to quit the smoking, but at least just try. The more you put your efforts in trying, you can achieve it. Smoking can lead to cause of preventable death and global public health concern. So it's always good to quit tobacco, to quit smoking. It will help you in your health. You will even see it that you'll be more healthier than when you are smoking. Smokers are liable to die early. 70% of smokers are liable to die early. So let's continue. Dietary fiber. The dietary fiber is a portion of plant derived food which can not be completely broken down by human digestive enzyme. Dietary fiber, the one that is always good for type 2 diabetics, is soluble fiber. This soluble fiber helps to control blood sugar and cholesterol. Soluble fiber is found mainly in apples, banana, oats, peas, black beans, lima beans, Brussels sprouts, and avocados. I'll still talk more about it. So, dietary fiber or raw veggies is the portion of plants derived food that cannot be broken completely by human digestive enzyme. Dietary fiber are diverse in chemical composition and can be grouped generally by their solubility, viscosity, and fermentability, which affects how fiber are processed in the body. Dietary fiber has two main subtypes, which is soluble fiber and insoluble fiber. So the one we're talking about is soluble fiber. That is the one that we want our type 2 diabetes patients to be taking. So soluble fiber. Soluble fiber, which dissolves in water, is generally fermented in colon into gases and physiologically active byproducts such as short chain fatty acid produced in colon by gut bacteria. Examples are beta glucan in oats, like I said in oats, barley, and mushrooms, and raw guar, xylem, insoluble fibrous and non-fermented fiber, is a bulky fiber that retains water as it is moved through the digestive system, easing defecation. Like this soluble fiber too, it helps you to go to toilet like normally. It is your defecation. Soluble fiber is generally viscous and delay gastric emptying, which in human can result in an extended feeling of fullness. Inulin in chicory root, wheat dextrin, oligosaccharide and resistant starches in legumes and bananas. All these are soluble, non-viscous fiber. Regular intake of soluble fiber such as beta-glucan from oats or barley has been established to lower blood level of LDL, that is low cholesterol. Soluble fiber are significantly lower your LDL cholesterol. Well done, everyone. Thank you for joining me once again. So let's continue. Although there is no cure to type 2 diabetes, many people can manage their condition effectively by making changes to their diet and lifestyle. Nutrition counseling can play a significant role in helping people make food choices that are right for them. So type 2 diabetes is the most common type of diabetics. That's why we're talking about it. We used to talk about the other if times permit us. It's affecting millions of people worldwide. It occurs when body cannot produce or use insulin correctly, leading to rise in blood sugar level. I hope you guys are still hearing me. If you have anything to ask, you can ask your question. I will answer you before I end the live. Thank you for joining me. So, like I was saying, type 2 diabetes occurs when there is too much sugar in the blood. The hormone insulin controls blood sugar level. Insulin signals to the body to move the sugar to cell, which store it for future energy. In type 2 diabetics, the body either does not produce enough insulin or does not use the insulin correctly. So medical professionals always call this insulin resistance. The symptom of type 2 diabetics tends to come on gradually. All the symptoms might not come once. It tends to come gradually, and person may have insulin resistance for 10 to 15 years before you started seeing the symptoms or receiving the diagnosis. Please, if you can still hear me, please try and indicate. Thank you for joining me. God bless you. So Learning how to manage the condition is and vital to prevent or delay the onset of this possible complication. So I was talking about nutrition counseling. So let me emphasize more on it. So nutrition counseling. Some people with type 2 diabetics need prescription medication to lower their blood sugar, but majority can achieve this through diet and exercise. Counseling by trained experts gives a person the skill and knowledge they need to reach the goal. Nutrition play a key role in managing type 2 diabetics, but there is no single diet to suit everyone living in this condition. So nutrition counseling involves like guiding you on what to eat, what to not to eat, how it's good for you to reduce your salt. So what an eating plan may include. Many people with type 2 diabetes begin managing their condition by losing weight. I mentioned it earlier. If you are type 2 diabetics and you are obese or you have weight, so it's better to start by losing your weight. Others can lower their blood pressure by cutting back on salt. Yes, you reduce your salt intake. It's good to take salt too, but you reduce the intake. It's better you reduce it. So a nutrition counselor will tailor a food plan to a specific person, but there are some general guidelines for making healthier choices, which we'll be discussing. A good healthy plan will include plenty of non-starchy vegetable and fruits, as well as lean meat, plant-based protein, and a mix of both. It will also lower your sugar and prioritize who's the whole food over heavily processed ones. For people with type 2 diabetics, the goal of an eating plan is to regulate their blood sugar. Carbohydrates play a significant role in this. Well done, everyone. Thank you for listening. I hope you guys are hearing me clearly. So there are 3 types of carbohydrates. We are not really going much into that, but let's just mention it. Types of carbohydrates. We have starches, sugar, and fiber. Eating more nutrient-dense carbohydrates that are high in fiber but low in sugar is the key. They are also carbohydrates, but they are lower in sugar. Like I said, they are lower in sugar, but the fiber are high. Those ones helps you to gain what we are looking for, like lower your sugar level. It helps you to regulate your sugar level. Well done, everyone. Thank you for joining me. So I hope you guys are hearing me. Hello, hi. I hope you guys are hearing me. Try to indicate if you are hearing me. Thank you. Well done. Okay. So, like I was saying, we are talking about diabetics, and now we are on type 2 diabetics. So, let's continue. Okay. We are talking about the types of carbohydrates. We mentioned starches, sugar, and fiber, and we also mentioned that the goal is to increase our fiber intake and reduce our sugar intake. So, as a general rule, people with type 2 diabetics should adopt the following measures, which are limiting food and drink that are high in added sugar. All this soda, is better you stop taking it. We should try and limit or reduce our soda intake. All these drinks that are high in sugar. Choosing whole grains, fruit and vegetables as carbohydrates instead of refined carbohydrates such as white bread, pasta and potato. They are also good. Being aware of recommended portion or sizes and sticking to them. Like I said, it's good to talk to get counseling from nutritionists to guide you on what and what to be taking and what that works for you. Eating more healthy fats, including avocados, nuts, and seeds. Limiting alcohol consumption if applicable. So, a well balanced diet requires a person to eat a variety of food from different groups. Meal planning involves combining this food in appealing ways, and this are where nutrition counselor comes in, where they counsel you on what and what to take. So, when you have type 2 diabetics, there are specialists that is okay for you to meet to check what and what you should be aware of. Primary care provider, like I said, your general doctor. You meet your primary care provider. Ophthalmology, which specializes in eye disease, because when you have this type 2 diabetes, it's likely to affect your eye. So you see ophthalmology to check your eye for you to be sure that it has not started affecting your eye. Also, endocrinology, it takes hormone disorder and metabolic. Nutritionists, like I said, we specialize on food and diet. So, going forward, so like I said, type 2 diabetes happens when your body can't use insulin properly. Without treatment, type 2 diabetes can cause various health problems like heart disease, kidney disease, and stroke. You can manage this disease by making lifestyle changes, taking medication, and seeing your healthcare provider for regular checking. So, what is type 2 diabetes? Let's explain more. Type 2 diabetes is chronic condition that happens when you have persistently high blood sugar level, hypoglycemia. How the sugar level, glucose level are 70 to 99 milligram per dl, milligram per deciliter. If you have undiagnosed type 2 diabetes, your sugar level are typically 126 milligram per deciliter or higher. So type 2 diabetes happens because your pancreas does not make enough insulin. Your body does not use insulin properly or both. This is different from type 1 diabetes. We might still talk about type 1 diabetes if time permits us, but if not, we'll talk about it later again. Which happen when autoimmune attack on your pancreas results in total lack of insulin production. That is type 1 diabetics. Type 1 diabetic happens when an autoimmune attack on your pancreas resulting to total lack of insulin production. So how common is type 2 diabetes? Type 2 diabetes is very common. like about 1 out of 10 people do have this disease that we're talking about. So the symptoms, like I mentioned earlier, the symptoms include increased thirst, unexplained weight loss, increased hunger when you're always hungry, fatigue, having headache, slow healing. Yes, if you are diabetic, always avoid cuts because the healing might be slow and it might not even heal at all. Numbness in hand or feet, blood vision, that is what I'm talking about, ophthalmology. They have to check your vision, your eye. Frequent urination and dry skin, all these are symptoms of type 2 diabetics. So going forward, symptoms, okay, like I said, tingling and numbness of hand or feet, unexplained weight loss, dry skin, and others. So if you have any of these symptoms, it's important to see your healthcare provider. Simple tests can diagnose, simple blood tests can diagnose type 2 diabetics. What are the causes of type 2 diabetics? The main cause of type 2 diabetes is insulin resistance. Insulin resistance happens when cells in your muscle, fat, and liver doesn't respond as they should to insulin. Insulin is hormone your pancreas make that is essential for life and regulating of your blood sugar levels. If your body isn't responding to insulin properly, your pancreas has to make more insulin to try to overcome your increasing blood glucose level, hypoinsulinemia. Yeah. If your cell become too resistant to insulin, and your pancreas can't make enough insulin to overcome it, it leads to type 2 diabetes. Several factors can contribute to insulin resistance, including genetics. If you have maybe your father, your mother, your grandparents have this disease, it's good to check out for it, to be on the lookout. Excess body fat, especially in your belly and around your organ, visceral fat, can also cause it. Physical inactivity, eating highly processed, highly carbohydrate food and saturated fat frequently can also cause it. Certain medication like long-time corticosteroid use, hormonal disorder like hypothyroidism and Cushing's syndrome can also cause it. Chronic stress and lack of quality sleep can also cause type 2 diabetes. Is type 2 diabetes genetic? Yes, it can be genetic. The cause of type 2 diabetes is complex, but researchers know that genetics play a strong role. Your lifestyle risks developing type 2 diabetic is 40% if you have one of biological parents that has it. So what are the risk factors for type 2 diabetics? You are more likely to develop type 2 diabetics if you have a family history of type 2 diabetics, either your biological parents or your siblings. If you are older than 45 years old, you have the risk factor. That is one of the risk factors too. Have overweight or obesity when your BMI is greater than 25. Physically active less than 3 times in a week. That's what I'm saying. Exercise is good. It's good to do exercise. And if you are black, my dear, being a black is a blessing, but also is one of the risk factors. Add gestational diabetics while pregnant. You might not be diabetic, but sometimes pregnancy brings some symptoms, brings give you some disease that you don't have before. So if you have gestational diabetic, it's likely for you to have type 2 diabetes. So I mentioned BMI, that is body mass index. So let's continue. How is type 2 diabetes diagnosed? The following blood tests help your healthcare provider diagnose type 2 diabetes. Fasting plasma glucose test. This lab test check blood sugar level. You typically need to get this test done in the morning after 8 hours fast. 8 to 10 hours fast, maximum 12 hours. Nothing to eat or drink except water. If you are going for this fasting plasma glucose test, fasting blood sugar, you won't eat. Like if you are coming, it's done in the morning. Like I said, it's done in the morning, and you have to fast for minimum of 8 hours, 8 to 10 hours before you can do the test. So a result of 126 milligram per dl or higher means you have diabetes. Also, another test that can be done is random plasma glucose test. This lab test also check your blood sugar, but can get it at any time without fasting. This random blood sugar, you can do it anytime, either morning, afternoon, night, anytime, and you eat before you do it. So random blood sugar can be done anytime, like I said, unlike fasting blood sugar. The result of 200 milligram per dl or higher means you have diabetes. Going forward, A1C test, that is glycolated hemoglobin test. This lab test measures your average blood sugar level over past 2 or 3 weeks, past 2 or 3 months. A result of 6.5% or higher means you have diabetes. In some cases, your provider may order for an autoantibody blood test to see if you have type 1 diabetics instead of type 2 diabetes, just to be sure the one that is dealing with. So what is the treatment for this type 2 diabetics? Unlike many health conditions, you may manage type 2 diabetes on your own with medical guidance or support from your healthcare team. This could include your primary care physician. This could include your primary care physician or endocrinologist, registered dietitian, like I said, to know your diet, what to be taking, certified diabetic care and education specialist, ophthalmologist, eye doctor, dentist. Your team should include your family member too, and other important people in your life. Managing type 2 diabetics can be challenging. You have to take several decisions every day for it, but everything you do to improve your health is worth it. So going forward, the core feature of type 2 diabetics management include lifestyle changes like more exercise and eating adjustments. Blood sugar monitoring. This blood sugar that I mentioned earlier, like random blood sugar, fasting blood sugar, you have to monitor it. Medication also, you have to take your medication at the right time all the time. Exercise for type 2 diabetics. Regular activities is important for everyone, either you are type 2 diabetics or you are okay, regular exercise is good. It's even more important if you have diabetes. Exercise is good for your health because it lowers your blood sugar level without medication in the short time and in the long time. It burns your calories and may help with weight loss. It improves blood flow and blood pressure. It increases your energy level and boosts your mood. It helps with stress management. Talk to your health provider before starting any of this exercise program. Like I said, you may need to take special steps before, during, and after physical activities, especially if you take insulin. That is one of the drugs for diabetics. So if you're on insulin, talk to your healthcare provider on the exercise program you want to be doing. The general goal is to get at least 150 minutes per week of moderate intensity physical activities. So, type 2 diabetics diet. Ask your health provider on registered dietitian to recommend meal plan that is right for you. What you eat, how much you eat, and when you eat are all important in keeping your blood sugar level in the range that your healthcare team recommends. The key to eating with type 2 diabetics is to eat variety of nutritious food from all food groups, and in a month your plan outline in general. All those type of food can support healthy blood sugar level, like lean proteins. Lean proteins consist chicken, eggs, fish, turkey, and etc. Non-starchy vegetables too, like broccoli, green beans, salad greens, and cucumbers. Healthy fats like avocados, nuts, natural peanut butter, and olive oil. We have complex carbohydrates too, like beans, berries, sweet potatoes, and whole wheat bread. So, blood sugar monitoring. So, monitoring your blood sugar is essential to finding how well your current treatment plan is working. When you're on drug, you are taking drug or maybe insulin, doing your exercise, you quit smoking, all those things is good, but you have to be monitoring it to know, oh, what I'm doing is working. It gives you information on how to manage diabetes. The result of blood sugar monitoring can help you to make decisions about food, physical activities, or dosing insulin that is good for you. Several things can affect your blood sugar. You can learn to predict some of these impacts with time and practice, while others are difficult or impossible to predict. That is why it is important to check your blood sugar regularly if your healthcare provider recommends doing so. There are 2 ways you can monitor your blood sugar at home if you have diabetes. Number 1, with glucose meter and finger stick. So that one is the fasting blood sugar, random blood sugar I was taking. Your glucometer. Just give me a minute. Let me get the glucometer for you just to show. Okay. Sorry. So this glucometer. So you get your glucometer. This one is apple shape, and your strip. This is the strip we use. When you are buying it, it comes with lacet. That lacet is just small needle that you will use. You clean your finger, either any of the finger. You clean very well with you can use it. You use something to clean, like cotton wool and spirits. Your cotton wool and water, you clean. Once you clean, you dry it, and then you just prick the finger. You bring out your strip. This is your strip. This is how this actual strip looks like. You bring out your strip, you insert it, you insert your strip where you can see it shows. Once it starts blinking red, and your once it starts blinking red, you put the blood, just a drop of blood on it, then it will reach. It will show you the result. So some are more. So if your own accurate, if your own glucometer is in mole, that means you are multiplying by 18 to give you milligram per dl. But if it's a milligram per dl, then you know that okay, if the result is 126 and above, that means you have diabetes. Then you monitor it. So another way to check at home is continuous glucose monitor. So you may choose either both method or variety reason, anyone that is good for you. Just talk to your healthcare provider. So type 2 diabetes medication. Your healthcare provider may recommend thinking medication in addition to the lifestyle changes to manage type 2 diabetes, which includes oral diabetes medication. These are the medications that you take by mouth to help your blood sugar level in people who have type 2 diabetes but still produce some insulin. The most commonly prescribed one is metformin. Your provider may prescribe more than one oral diabetes medication at a time to achieve the best glucose management. We also have GLP-1 and dual GLP-GRP agonists. These are injectable medication that mainly help to manage blood sugar level in people with type 2 diabetes. Some GLP-1 agonists can also help to treat obesity. Insulin. Synthetic insulin directly lower blood sugar level. These are several types of that we have. There are several types of insulin. We have like long-acting and short-acting types. You may inject with syringe. You inject either with syringe or pen. Use inhaled insulin or use an insulin pump. Other medication, you may take other medication to manage coexisting conditions like high blood pressure and high cholesterol. Can type 2 diabetes be reversed? Okay, type 2 diabetes is chronic, long-time disease, which means you must manage it for the rest of your life. There is no cure for type 2 diabetics, but you can manage it with lifestyle changes, medication, and blood sugar monitoring in a way that keeps your blood sugar level in a healthy range. If you stop managing it or undermanage it, your blood sugar will go back up. Can I prevent type 2 diabetics? Yes. Certain strategies can lower your risk of developing type 2 diabetes, which or delay its onset, which includes exercising regularly at least 150 minutes in a week, maintaining a weight that is healthy for you, eating nutritious food, not smoking. Unfortunately, some people have such strong genetic risk factor that even lifestyle changes are not enough to prevent developing type 2 diabetes. So what is the outlook for type 2 diabetics? My time is fast. Okay, let's. If you have type 2 diabetes, your outlook depends on several factors like your age at diagnosis, how often or how well you are able to keep your blood sugar level in range. If you have other conditions like high blood pressure or cholesterol, your access to healthcare, diabetes management tool or medications, nutritious food, and support from loved ones. Untreated or undermanaged type 2 diabetes can lead to a range of health conditions. What are the complications of type 2 diabetes? As your blood touches as your blood touches virtually every part of the body, having undermanaged type 2 diabetics that results in continuous high blood sugar over a long period of time can damage several areas of your body. Potential complications of type 2 diabetes include cardiovascular disease, including coronary heart disease, peripheral artery disease, cerebrovascular disease, heart attack, stroke, and also eye conditions including diabetes-related retinopathy, diabetes-related macular edema, cataract, glaucoma, and blindness. Additional complications include diabetes-related nephropathy, that is kidney disease, diabetes-related neuropathy, that is nerve damage, skin condition like dry skin and bacterial and fungal infection, foot problem like ulcer and infection that can lead to gangrene, gum disease and other oral health problems, hearing loss, digestive problems including gastroparesis, sexual dysfunction. Short-term complications of type 2 diabetes include hyperosmolar hypoglycemic state. Is a life-threatening complication in type 2 disease, in type 2 diabetics. Hyperosmolar hypoglycemic state. Just 10 minutes, please. Just 10 minutes. During your come, sorry. When your blood sugar are too high for a long period of time, leading to severe dehydration and confusion. Symptoms usually come slowly and can take days or weeks to develop. Symptoms include very high blood sugar level that is over 600 milligrams per day or so high. Mental changes such as confusion, delirium, and experiencing hallucinations. Loss of consciousness, dry mouth, and extreme thirst. Frequent urination, blurred vision, or loss of vision. Weakness or paralysis that may be worse on one side of the body. This hyperosmolar hyperglycemic state is a life-threatening that requires immediate medical treatment. If you experience these symptoms, please visit visit hospital, please. Thank you. So, how do I care for myself if I have type 2 diabetes? Type 2 diabetes is a complex condition that requires daily management efforts and planning. Some tips that can help you to manage type 2 diabetes include try to stick to healthy lifestyle changes, regular exercise, and eating plan at core parts. It's very important in type 2 diabetes management. Set small goals and make one change at a time. It helps you to prevent becoming overwhelmed. Check your blood sugar regularly. Checking your blood sugar regularly with a finger stick, like the way I showed you earlier, and meter, or using a continuous glucose monitor (CGM) is crucial to managing diabetics and preventing complications. Follow your healthcare provider guidance for how often should be checking it. Take your medication regularly. Follow your healthcare provider instruction for taking your medication if applicable. See your diabetics provider regularly. It is important to see the provider who helps you to manage type 2 diabetes regularly to be sure that your management plan is working. Don't be afraid to ask them specific questions. See other provider regularly, or especially your eye doctor. Type 2 diabetes can cause complications in various areas of your body, but especially your eye. It is important to see ophthalmologist at least yearly so that you can check the health of your eyes. Have a sick day plan. Talk to your diabetics provider about how to take care of yourself and manage type 2 diabetics when you are sick. Illness can make it more difficult to manage blood sugar level and can trigger HSS, that is the hyperosmolar hyperglycemic state. So, stay educated. Don't be afraid to ask your health provider questions about type 2 diabetes. The more you know about type 2 diabetes and your management, the more likely you'll be able to live healthy and prevent complications. Find community, like people to talk to relate with. Take care of your mental health. People with diabetics are 2 to 3 times more likely to have depression and are 20% more likely to be diagnosed with anxiety than those without diabetes. Living with a chronic condition that requires constant care can be overwhelming. It is important to talk to a mental health professional if you are experiencing signs of depression or anxiety. When should I see my healthcare provider if I have type 2 diabetes? You will need to have regular appointments with your healthcare team to be sure you're on track with your type 2 diabetes. So, all this being said, okay, let me just talk a little about gestational diabetes. Gestational diabetes is those who develop gestational diabetes are higher in developing type 2 diabetics later, and this gestational diabetes happens when you have diabetics during pregnancy. It always happens during pregnancy, but having gestational diabetes, like I said, can, like, you have higher risk of having type 2 diabetes later in life. In most cases, that is not symptoms. A blood sugar test during pregnancy is used for the diagnosis of gestational diabetes. The symptoms might include excessive hunger, excessive thirst or fatigue, also frequent urination or yeast infection. So, if there is anyone with some question, I would like to take your question first. I think I only have 1 minute to go. So, the treatment for gestational diabetics, I won't really go more into it, but the treatment include blood sugar monitoring, like I mentioned in those type 2 diabetics, healthy diet, exercising, and monitoring the baby too, because now this is gestational diabetics and you are pregnant, so you have to monitor the baby while you are monitoring yourself. If blood sugar is too high, medication is required. healthy diet, diabetic diet, and physical exercise. Anti-diabetic medication too and insulin can also be given. So thank you all for joining me in this live session. I really appreciate. Thank you and God bless you. If you have any question, you can drop it. And like I said, health is wealth. Always monitor your health. Monitor if you are. It's good to do to go for checkup. Even some people might be diabetics and they won't know. So once you go for checkups, you have you have the idea of what is happening in your body. You have idea of what is happening with your health. So always go for checkup. Always check your blood sugar, check your BP. Just do some checkings. Your take your health. Let your health be your priority, because health is wealth. It's when you are healthy that you'll be able to do that work. It's when you are healthy that you'll be able to travel, do other things, attend to your family. So prioritize your health. Thank you so much for joining me in this live. I really appreciate. God bless you. Happy Sunday and happy new week. Happy new month too. Thanks for joining. Bye. Thank you. Thank you so much. Thank you. Bye.